A fracture is a break or disruption in the structure of the bone. As a nursing student, it's important to know the different types and classifications of fractures. First, fractures can be classified based on if they're open or closed. A closed fracture is when the bone is broken but the skin remains intact. An open fracture is when the bone punctures through the skin, and for this you want to watch for complications such as osteomyelitis since the patient is more prone to infection. They can also be characterized based on if they're complete or incomplete. An incomplete fracture or partial fracture means the bone is not completely broken into two pieces. It's still partially intact. And a complete fracture means the bone is broken into two separated pieces. You'll also need to know the different types of fractures. A green stick fracture is when one side of the bone is bent and cracks on the other side. A comminuted fracture is when the bone is broken into multiple tiny fragments. A spiral fracture is when the fracture twists around the bone. A transverse fracture is when the break is straight across the bone. An impacted fracture refers to two pieces of bone driving into each other. And an oblique fracture is when there's a diagonal break across the bone.